Thank you everyone for joining us for today's webinar with Dr. Michael Yapko around mental health in honor of Mental Health Awareness Month in the US. So just some housekeeping rules. We'll be having time for Q&A at the end. I've got a few questions of my own. If you do have any questions, you can put them in the Q&A chat box and then we'll go through and answer them if we have time at the end. Maybe to get started, Michael, do you want to introduce yourself, discuss your background in hypnosis, mental health, and your relationship with Mindset Health?
Sure. I am Michael Yapko. I'm a clinical psychologist. I live in the San Diego area, Southern California, and I have had the unique experience of having been exposed to clinical hypnosis at a very early age and had almost fully half a century to really study the intricacies of hypnosis. I've been in clinical practice. I'm retired from practice now, but for almost 40 years. And I've authored 16 books, many of them on hypnosis, including the leading text in the field, now in its 5th edition, called Transwork, an introduction to the practice of clinical hypnosis, which I'm pleased to say most hypnosis organizations use as their course text. And I have also had the unique opportunity to travel the world teaching by invitation to professional audiences. And so I've had quite a career and quite a very deep involvement in the field of hypnosis and its relevance to psychotherapy. And then it was almost 3 years ago exactly now that Alex and his brother Chris approached me with their plan to establish a telephone app, a phone app, that would provide hypnotherapy sessions to people on demand, available 24/7. And because I am not the most technologically sophisticated person on the planet by a long shot, I really didn't fully grasp what their project was about. And so I was a little reluctant to get involved, to be honest with you. And then little by little, Chris and Alex gave me more detail and helped me understand better what the value of such an app would be. And Mindset was born and quickly developed and has continued to evolve and morph into different programs and different formats. And it has been my pleasure, truly my pleasure, to be associated with Chris and Alex and the whole Mindset crew. And the fact that these programs have been made available to people and that people are using them with great feedback, great success, has been enormously gratifying. So I am grateful to Alex and Chris for inviting me into this project and letting me do my share of it. So
it's been an honor from our end to be working with you and learning a lot from you, even though we're not practitioners, learning from your textbooks, learning from you and your discussions with us. So we're definitely grateful as well. You mentioned earlier that you retired from clinical practice. What were your main focuses or areas of focus during your clinical practice?
Well, the use of hypnosis as a vehicle of treatment has been every day of my professional life, been part of my practice. Clinically, I was most intensively focused on the disorder of major depression. Major depression is the most common mood disorder on the planet. I think you're in clinical practice for about 38 seconds before you see your first depressed client. And even when depression isn't the main or primary diagnosis, it's certainly a secondary diagnosis since people don't feel good about the problems that they have. And so to develop briefer ways of addressing depression and more strategic ways of addressing depression and evolving a more multidimensional view of depression has been my focus. And I think I've been really quite at the leading edge of pushing the field in the direction of recognizing this is far less a medical disorder than it is a social one. and how important it is to empower people with the kinds of skills that are known to not only reduce depression, but also prevent depression. And so great strides have been made. I have literally dedicated my life to this. And I'm really pleased with how much more precise and how much more effective treatment has become over the years.
And how does hypnosis and clinical hypnosis help with a condition like depression?
With depression, really just about any condition where the person's attitude or beliefs play a role. Depression is, by and large, it's a disorder of perspective. You know, it's one of the curious things about depression is that it has a very high response rate to placebo-based interventions. And so there are lots of things that therapists can do that will help people feel better. But for me, it's more than that. It's not just about feeling better, it's about being better. And to be better means learning some pretty specific skills. And the skills fall in a number of domains. Problem-solving skills is one of those domains. You know, the great American humorist Mark Twain once said, life is one damn thing after another. And he's right about that. And the people who have better problem-solving skills do better in life. Social skills, knowing how important relationships are in providing support and providing contrasting viewpoints is really an important thing too, and helping people build good relationships is vital. And teaching people problem-solving skills, how to really address problems in ways that are realistic and effective. And as soon as we start talking about teaching people skills, hypnosis becomes immediately relevant, because how much of therapy is about education, teaching, and how much better do people learn when they're more focused, when they're more relaxed. So hypnosis provides a very special context in which people can more readily grasp new ideas, let go of obsolete perspectives that just don't fit anymore, and more readily adopt new perspectives that will serve them better. And the fact that we can use hypnosis as a vehicle of teaching is one of the great gifts, I think, that we can offer people who are suffering in one way or another. And it's really why what Mindset is doing is so critically important, to be able to make this tool readily available to people so that they can benefit from it in a widespread way, a diverse way, is really a wonderful contribution.
You touched on it a little bit there. How do you best define hypnosis, and how do you then differentiate hypnosis from clinical hypnosis or hypnotherapy?
Mm-hmm. You know, the field has been wrestling with the question of how to define hypnosis from the very beginning. And it's literally true that every 5 years, a blue ribbon panel of experts is tasked with coming up with a definition of hypnosis that they think most people in the field will agree with. And that has really been elusive. What we can do is, rather than define it, it's easier to describe it and describe what the experience is like. And what hypnosis is about is being very focused. Typically, relaxation is a part of the process. But there's something special that happens when people get very focused, very absorbed. And I think that the easiest way I can describe or even define hypnosis is paying attention with intention. Paying attention with intention. Hypnosis is an unapologetically goal-oriented kind of process. We're doing hypnosis for a reason. There's something that we're trying to teach, some message that we're trying to get across to people. And so hypnosis can be applied in a lot of different ways in a lot of different contexts. And so the way of defining it is really dependent on the context it's in. It's different to do medical hypnosis than it is to do dental hypnosis, which is different than doing sports hypnosis, which is different than doing educational hypnosis. So that it's really the context in which it's applied that gives it a greater specificity. So when we're talking about clinical hypnosis, we're talking about the use of hypnosis in a clinical context for some therapeutic outcome. And so most of the time that refers to psychotherapy, being able to help people emotionally, mentally deal with some issue that they're facing, whether it's depression or anxiety or anything else really, phobias, obsessions, compulsions, any kind of psychological disorder. Now, the term hypnotherapy is widely used in a number of different places, not so much in the United States. And me personally, I've never been a big fan of the term hypnotherapy because it doesn't really say much. It suggests that hypnosis is the therapy, and hypnosis isn't the therapy. Hypnosis is a vehicle for delivering the therapy. So when people listen to the mindset sessions, for example, they'll be invited to relax and focus and close their eyes and pay intense attention to the ideas that are being presented. They'll obviously hear everything, know everything that's being said to them, and hopefully the ideas will resonate with them and they can say, yeah, I like that idea, I can use that. But the ideas aren't the hypnosis. They're delivered during the experience of hypnosis. So, you know, it's really in many ways just quibbling about terminology. You know, to call it hypnotherapy, is it wrong? No, it's just from my perspective, it's just not descriptive enough to say what's really going on there. So I'd much prefer to be able to talk about hypnosis that's being delivered from a cognitive behavioral perspective, or hypnosis that's being delivered from an emotion-focused perspective, or whatever perspective or therapeutic style whoever is doing the hypnosis tends to practice in.
I know something that you've said to us that I think resonates is that what you focus on, you amplify. And that idea that, you know, hypnosis is really about focusing. And then when you focus on something, it amplifies the effectiveness. And so when we talk about it, yeah, it's making CBT potentially more effective, or a more effective vehicle for that, or guided for something like Nerva and irritable bowel syndrome. It's, you know, guided imagery and direct suggestion. So a lot of different techniques within that layer of hypnosis.
Yeah, I'm glad you brought that up. You know, that is the first lesson when I'm doing my clinical hypnosis trainings for professionals. First lesson they learn is what you focus on, you amplify. And then come the clinical questions. What do we want the person to focus on, and why? How, by focusing on this, is it going to be helpful to them? And in many ways, it's probably the easiest way to think about the nature of hypnosis, that we're going to grab someone's attention and redirect it. Because so many of the problems that people have are problems of focus. They focus on the unchangeable and hurtful past instead of the positive future possibilities. Or they focus on their feelings when they should be thinking a bit more rationally, or vice versa. They're thinking when they should be feeling. Or they're paying attention to themselves when they should be paying attention to their family members or spouse. Or they're paying attention to their spouse and family members when they should be paying attention to themselves, based on the outcome that they're trying to create, where the focus is going to be best for them. And so to be able to guide someone's focus and direct it in ways that wouldn't have occurred to the person spontaneously is really what the value is of having a guide. And so these hypnosis sessions are sessions that provide guidance in a direction, to a perspective, a way of thinking about things that makes those kinds of problems easier to solve. And the best part is, these are empirically supported. This isn't just opinion. What's really happened dramatically over the course of the last 20 years, especially now that we have much more sophisticated scanning technologies like fMRI and SPECT scans and CAT scans, we have a much better understanding of, even at a physiological level, what's happening. But the point is, we have very sophisticated studies now addressing the key question. If we do cognitive behavioral therapy without hypnosis, and we do cognitive behavioral therapy with hypnosis, will the addition of the hypnosis enhance treatment outcomes? And the answer is definitively yes. The data are abundantly clear about that the addition of hypnosis to a treatment regimen absolutely raises the level of therapeutic effectiveness of that regimen. So there too is another great reason why hypnosis is a valuable addition to treatment.
We touched on the myth that, hypnosis is the therapy when it's more the vehicle for therapy. Is there any other common myths that you've seen during your practice or outside of that it might be worth for us to address and, put to bed?
Yeah, the field of hypnosis carries a lot of baggage from all the myths and misconceptions that people have. Hypnosis is just such a unique phenomenon because you can turn it into a Las Vegas stage show, and that's hypnosis. And then you have serious clinicians who are doing hypnosis. And for a lot of people, they're trying to figure out, how do you make this transition? So, the biggest myth I think that people have is that somehow they're going to lose control of themselves, because that's what they've seen in movies and television shows where hypnosis is blamed as the reason the person engaged in some silly behavior or criminal behavior. And of course, I'm a psychologist. Nobody ever walks into my office and says, "Hi, will you help me lose control of myself?" If hypnosis was about losing control, it wouldn't interest me in the least. What has fascinated me about hypnosis and kept me fascinated for the last half century is how much control it increases in people. Can you imagine what it's like for somebody to discover that they can manage their symptoms of irritable bowel syndrome by learning to focus and relax, or what it's like for somebody to learn that they can go to sleep without having to drug themselves by learning techniques of self-hypnosis, or what it's like for somebody to learn that they can manage the level of pain in their body. And when people have these experiences with hypnosis, it has really profound consequences. It changes people's view of themselves, that until you have the experience, how would you know that you're capable of altering your relationship to your body? Or how would you know that you could alter your relationship to your mood? And that's what I mean in part when I talk about hypnosis providing a context. It provides an opportunity for you to relate to yourself in a different way. And that's when people discover resources they didn't even know they had. So that's the myth, that it's somehow disempowering, when it's the exact opposite. It is still the most empowering approach that I'm aware of. But other myths persist too, that somehow everything that ever happens to you is in your mind somewhere, and all you have to do is be hypnotized and you'll be able to recover these hidden memories. And that's a myth. The possibility is far greater that if you go looking for memories in hypnosis that you suspect are there but can't actually remember, that you'll engage unwittingly, unintentionally, in a process called confabulation, of filling in the gaps in your memory. And the point there is that hypnosis isn't a lie detector. You're not going to get at the truth by experiencing hypnosis. But there are lots of different myths that people have, and those are just a few of the key ones, I think.
You mentioned around the idea that, it's a powerful realization to know that you can, be empowered to change these things, to enter hypnosis, to have this massive impact on your condition, your life. I know a lot of people have spoken about the idea of hypnotizability and am I hypnotizable? Could you touch on the idea of whether everyone is hypnotizable, or is it some certain percentage of the population? And does that mean anything about who they are?
Yeah. This is a deceptively simple question because you'd think there's a simple answer to it. But this has been one of the most researched and most divisive issues in the field. Who is capable of hypnosis? How do we measure that? Can we predict who's going to be responsive? And I can tell you that the two greatest researchers that we've had are by the name of Ernest Hilgard and Andre Weitzenhofer, who spent 30 years in one of the most prestigious laboratories in the country, the Stanford University Hypnosis Research Lab, trying to define and measure hypnosis. And they succeeded to a certain extent, but the question always remained, how much of people's responses to hypnotizability tests are simply their response to the test and not a true reflection of their actual hypnotic abilities? Well, when they retired, Andre went and opened a small clinical practice for the first time. He had never tried to do hypnosis for helping people change. And it was only then that he came to the realization that the motivations that people have in therapy are really quite different than the motivations they have in the laboratory as research subjects. So it's still kind of an open question. How do we define somebody's ability to respond? My personal preference is, instead of using the term hypnotizability, I would much rather talk about people's hypnotic talents. And what happens in hypnosis is when people discover that they're capable of these unique responses, whether it's being able to generate an analgesia so that they can reduce pain in their body, or whether it's generating an age regression where they can have the experience of going back in time and kind of reliving, re-experiencing vivid memories that have been significant for them. But the point in all of that is you're never really going to know what somebody's capable of until you actually do hypnosis with them. So it's amusing to me, the people who say, well, I don't think I can be hypnotized. If you say that, you're not flattering yourself. The people who are more hypnotically responsive tend to be the people who are better at being able to focus, better at being able to set aside objective reality for a little while in order to get internally focused on their own subjective reality. That's a skill. That is part of what I mean when I use the phrase hypnotic talent. So, for somebody to say, oh, I don't think I can be hypnotized, you're not flattering yourself with that. And it really is valuable to discover what you're capable of in that regard. How do you build the kind of focus that would be beneficial therapeutically? How do you build the kind of relaxation that makes the very process of change so much easier and less stressful and more? And how do you build that kind of openness and receptivity to new ideas and possibilities? And so the way that I've dealt with this personally is I will assume as I begin a session that this person is capable of some degree of each of these kinds of experiences, some degree of focus, some degree of attention, some degree of relaxation, some degree of openness to new ideas. And now the question is, can we tap into that and expand it and make it more therapeutically relevant?
If I've been listening to you talk today, if one of the hundreds of people that are listening today, and I'm like, I'm really interested in trying hypnosis and clinical hypnosis to help with my mental health or help with my IBS, how do I best access that?
How do you best access
hypnosis? Find someone to work with or find someone to help me?
Well, there's a couple levels of response to that. We certainly have evidence to show that the more personalized the session, working with someone one-on-one, is ideal. But there are a lot of reasons why people can't do that, whether it's about availability of somebody nearby, whether it's about the costs involved, whether it's about the effort it takes to go someplace and see somebody, the time off of work and everything else. And so if you can do that, there are organizations that will provide you with referrals. Here in the United States, we have the American Society of Clinical Hypnosis as probably the most well-known professional hypnosis society. They have a website at asch.net. And on their website homepage, you can find professionals in your area that are certified to practice hypnosis. The only people who can join are clinicians. You have to be a licensed professional in order to join the American Society of Clinical Hypnosis and be on their referral list. But it's different in different countries. You know, in Australia, you have a number of different hypnosis organizations, and the same is true in Europe. So the standards differ from country to country, but it's more important that you're dealing with someone, if you're going to go the individual route, who uses hypnosis as a tool, but their primary qualification is as a licensed professional, as a licensed psychologist, marriage family therapist, professional counselor, or any of the kinds of degrees and licenses that qualify someone to practice. And then, of course, the second level is what we've accomplished with Mindset, to provide people with the opportunity to have sessions that speak to and instruct you in the skills that you're going to need to realistically address and resolve problems. And for most people, I would guess, that will be a really useful thing. They'll get benefit from it. And so even though it isn't entirely personal, it will still have ideas that pretty much apply to everyone. That if you're alive, you've had the experience of being afraid of something. That if you're alive, you've had times when you haven't felt very good about yourself. You know, these universals of experience that we can speak to in these hypnotherapy sessions and still provide a meaningful benefit. So the fact that we have a range of ways of benefiting from the experience, I think is really encouraging and should help people decide now's a good time to get the help I want.
Amazing. And if anyone else, will share some of these links in the email as well that Mike was talking through as well. You can also visit mindsethealth.com to learn more about the programs that we offer, like Nerva, EVR, Mindset, our other hypnosis programs. So switching gears a little bit to talk more specifically about mental health, as it is Mental Health Awareness Month. Could you just give us a high-level overview of how common is it to have a mental health issue, and what are the sort of common conditions that people may have on this call?
Yeah. You know, there are diagnoses that, problems that people have that are diagnosable. And then there are just problems that people have. If you're alive, you face challenges. The harsh truth about life is the people we love die, the dogs that we care for get hit by cars, the jobs that we love, the budget dries up and we get laid off or made redundant, and on and on and on. Nobody gets out of here alive. We all face issues, we all face problems. And that, is the first question, is how bad does it have to get before somebody's willing to get help or is willing to seek help? And so, it being Mental Health Week or month, it's really valuable to appreciate if you are capable of moods, then you're capable of mood problems. If you're capable of fear, then you're capable of anxiety problems. And just in terms of sheer prevalence, there is a field called epidemiology. And epidemiology is the study of prevalence. And most countries around the world regularly conduct surveys to find out what kinds of problems is their population suffering from. And it's typically how we decide where research dollars go. If more people have this problem, then we throw more money at it than if people have this problem, which is a relatively rare one. So the most common problems are, number one, anxiety, number two, depression. And this is something that people experience. It's something that, depending on the degree, it can just be something that you manage, or it can become quite debilitating. And that's why the question I just posed is really the salient one. How much do you have to suffer before you say enough? Because the other key point to make about both of those disorders is they're both highly responsive to good treatment. People get better. And that's really important. But to kind of wait around and hope that somehow you're going to be inspired to learn something that's going to make the difference. When you can talk to experts, therapy these days is a relatively short process. It's, for a lot of practitioners, it's get in, solve the problem, get out, teach people the skills that they need to learn and send them on their way. So, most of the time, this isn't going to be months or years of treatment. It's not going to be talking about your childhood and, all that kind of thing. It's more about get in, solve the problem, and get out. So that's an important thing for people who want to learn about mental health for them to know. But, for as long as you live life and face every day's new challenges, you're going to be challenged, you're going to be tested. And it's pretty easy to get caught up in your feelings and subjective beliefs and misinformation and disinformation and reaching wrong conclusions about life experiences that end up hurting you. And it really, really helps a lot to have somebody be able to point out to you, no, that's not really true. And it's a belief that hurts you, and it's an arbitrary belief, and you really don't need to stay with it. And no, you can't really use that experience as your frame of reference. I mean, people paint themselves into the corners all the time. People who say, gee, I'll never be happy. Why not? Because I never have been. Or I'll never get a good job. Why not? Because I've never had one. Or I'll never have a good relationship. Why not? Because I've never had one. And of course, the most popular one of all, I won't be happy until my parents treat me better when I was a kid. And you see how convoluted that is, to where how you have to untie that knot if you're going to get anywhere. So just one last thought, and we can go to the next question you have, Alex. But the last thought is, what is mental health? Mental health isn't the absence of symptoms. Nobody is free of symptoms. Nobody. Everybody's got their little quirky things and their little, unusual ways of looking at things and doing things. That's not the problem. To me, take it for what it's worth. What mental health is about is how you adapt to the circumstances you face. That every time you walk into some new situation, or even a familiar situation, how quickly can you recognize, here are the skills, here are the resources you're going to need to have if you're going to handle this situation well, effectively. And to be able to reach inside yourself and pull out the very skills, the very resources that you're going to need to handle things well. And what I strive for is I want people to be able to walk away from some difficult situation, being able to say to themselves, I like the way I handled that. I handled that well. And of course, that's the self-esteem part. Self-esteem is something that builds. And too often people get it backwards. They think if they feel better about themselves, then they can behave better. And I'm suggesting quite the opposite, that it isn't until you start doing things better that you're going to feel better. And so encouraging people to be active in their own behalf, encouraging people to take charge of their life, instead of blaming their childhood, blaming their parents. And that's not to minimize it. Some people have had really terrible experiences in their history, but you don't want to define yourself by those experiences. And to be able to look forward to how things can be better, what new things you can learn, what new things you can experience that will make a difference. That, to me, is what mental health is all about.
Thank you, Michael. That was really, really helpful and enlightening. We've spoken about how seeking a healthcare practitioner or hypnosis app like Mindset if you're looking to explore your mental health or like address some of these common issues. Is there any behavioral things that people can do or lifestyle changes that they can make to potentially promote healthy wellness and well-being?
Well, absolutely. This is, again, one of those things that the amount of evidence is just so overwhelming. Nobody even there's nothing to argue about anymore. Your lifestyle is a product of choices that you make. And some people make some pretty bad choices. Other people are pretty good at making choices that encourage a healthier way of living. And okay, the mental health part I've talked about, being self-aware of your resources and knowing how to use them, knowing how to access them when you need them. And of course, physical health matters a lot as well. And what's interesting is as people face stressors, you will see the range of coping styles that people have. And anybody listening to us right now, if I were to ask you directly, what is your coping style? How do you cope with stress? There are people who have unfortunately developed negative coping styles. They face a challenge, so their response to it is go out and get drunk, or take some drug, or eat all the wrong things that work against them. And then there are people who have positive coping mechanisms, who know that this is a time that I'm better off taking a long walk in the forest, or taking a long walk along the beach, or calling some friends for support, or taking a long hot bath and just relaxing. And they've got ways of handling stress that enhance their health rather than work against their health. And the value of a good diet and good sleep and all those kinds of things, regular exercise. There was just a study published literally last week. It's called a meta-analysis, which is a study of studies, looking at the question of how does regular exercise influence anxiety and depression. And remarkably clear, exercise has the same treatment success rate as antidepressant medications, with a far lower relapse rate. Getting people to exercise, for some people it's second nature and they can't go a day without it. And other people, the very idea of taking a walk around the block just practically, overloads them into a state of panic. So, learning how to evolve that kind of relationship of an attitude of protectiveness. But this is, what's different from person to person. Here in the United States, we have more than 30 million people who smoke cigarettes. Every single one of them knows this is damaging to your health, but they do it anyway. We have, from an emotional perspective, lots of evidence that social media works against people's mental health. Doesn't stop people from checking their phones on average every 12 minutes. And we know in many ways what the best things are to do, and then we just don't do them. And there are lots of excuses that people make, but it is something to strive for. And especially these days when we face tougher health challenges than ever, the most recent, which and still ongoing, is the COVID pandemic. Here we are now in the United States, where last May 31st, about 20,000 people a day were getting infected. And this May 31st, which is today here, yesterday where you are, more than 100,000 people a day are getting infected. There is a resurgence, and trying to get people to wear masks, people who can't seem to distinguish between personal freedom and social responsibility. So, the ideas about taking care of your health, we know what they are. And it really is about people giving themselves a good talking to for how to start to integrate those things into their lifestyle.
Thank you. That's super helpful. And hopefully for everyone on the call, we can take some actions that can help improve our mental health in honor of this Mental Health Awareness Month. I know for a lot of people who are on this call who may have IBS and also have a comorbidity with anxiety or depression, are interested to understand how does mental health and your physical health in that certain relationship, how do they interact with each other? And so the mind-body relationship and how they can affect each other.
You're asking tough questions today, Alex. This is a really relatively new area. The field of psychoneuroimmunology is really only not even 20 years old. But we have obviously lots of evidence to show that the mind and body are related. As obvious as that seems, a lot of people didn't think about it that way for a very long time. You know, there was the body over here and there was the mind over there, and let's just treat the body. And it came to be recognized that every problem has multiple components to it, that it isn't just your body, it's also your spirit, it's also your emotional makeup, it's also your belief systems. And so these days, whenever diagnoses are made, even in the medical world, the consideration is always there. How do we involve the person's psyche? How do we involve the person's mental capabilities, mental processes? And it's fascinating how the mind can, in some ways, fool the body, and how the mind influences physical responses. So just to give you one recent study that I found enlightening as well as amusing, which I think people listening will probably share the same feelings. This was a study that was recently done at University of Oslo in Norway. And I think most people know that the way your eyes work, if you're in a brightly lit environment, the pupil of your eyes will constrict. And if you're in a dimly lit area, the pupil of your eyes will dilate, bringing in less light, bringing in more light, depending on the lighting conditions you're in. Now, this isn't something you have conscious control over. If I say to you, okay, I'd like you to dilate your eye now, what are the odds of you being able to do that? But this is the fascinating thing about hypnosis. So this study at the University of Oslo involved pupillometrics, measuring the pupil of the eye in response to changing light conditions. So before they do any hypnosis, they measure the pupil of the eyes under different conditions. So they say, okay, now we're going to brighten the room. Then they turn up the lights and measure the constriction of the pupil. Then they say, okay, now we're going to dim the lights in the room. And then they measure the dilation of the pupil. Now they do the hypnosis. Get focused, get relaxed, focus, focus, focus. Okay, now once again, we're going to brighten the light in the room. Now, once again, we're going to dim the light in the room. And in response to the suggestion that the light was being brightened, pupils constricted. In response to the suggestion that the light was dimming, pupils dilated. In actuality, they never changed the lighting.
Wow.
People responded to the suggestion that the lighting was changed, and their body responded to that suggestion. Now, the exact pathway, how does a suggestion become a physical response, is one of the things that is being examined as we speak in physiological laboratories all around the world. What exactly is the pathway that allows a mental suggestion to turn into a physical response? And it can be very dramatic. Part of my practice was in working with people who suffered very serious physical diseases, people who suffered debilitating diseases, people who were in pain, people who were going to have surgery, but they were allergic to chemical anesthesia, who wanted hypnosis to be their anesthesia, where hypnosis was literally the only anesthetic they had while they're having their body cut open and having surgery. Now, if you ask me as a hypnosis expert, how can I mumble a few words to somebody, their body goes numb, and now a surgeon can cut them open and they experience it as pain-free? My sophisticated answer is, beats me. I'd love to know the answer to that myself. And when anybody knows the answer to that question, go to Stockholm and pick up your medal. You will have earned it. So it's one of the biggest questions that we have. How does that happen? But the point is, it happens. That in response to suggestions. So for example, with pain management, when I'm working with somebody and I'm suggesting to them that they can experience a sense of numbness in the body part that previously was in pain, do they know that I have suggested that? Of course. Did they hear the suggestion? Of course. And then when I say to them 10 seconds later or 30 seconds later or a minute later, okay, so is that part of your body numb now? And they say, yes. If I ask them, how did you do that? 99% of the time, the answer you're going to get is, I really don't know. It just happened. And in the world of hypnosis, that's a phenomenon called automaticity. Automaticity, how a response develops on an automatic, hence unconscious basis. The person is fully aware of the suggestions, but how and what makes it possible for their body to respond to it is still a mystery.
Fascinating. That's really wild to hear. I know there was a study with irritable bowel syndrome patients where it was a balloon study. So essentially they put a balloon up inside their colon, and many people with IBS have visceral hypersensitivity, so overly sensitive nerves. And so normally you can inflate the balloon so far, but then they experience pain. Then they do a session of hypnosis, and straight away they can inflate the balloon to normal ranges without any change. Like the pain was there, the nerves are overly sensitive. That is true physiological response. And within just a hypnosis session, we're able to turn down the perception of those signals and the balloon gets bigger. So it's just wild stuff.
Well, it sounds utterly fantastic. And if you've never been exposed to these things, it seems entirely implausible. And yet this is where the science has gone. What is it about people that allows them to have these kinds of experiences? And you're talking about a physiological treatment of inflating a balloon. And what a lot of people discover is that they learn to do self-hypnosis, they learn to relax their body, they learn to change the way their body processes food and processes stress, and their IBS symptoms go away without any physical treatment at all. That's remarkable. And yet it's one of the most successful applications of hypnosis. That when we look at the variety of ways that hypnosis has been applied, and what you see in the medical journals as well as the hypnosis specialty journals are extraordinary summaries of people who have been doing serious clinical work, enlisting the aid of people's own innate resources. And that's what I mean when I was earlier talking about people's hypnotic talents. How would you know that you're capable of altering your sensations in your body until you try and create that experience and have somebody working with you that guides you through that experience? And then when you discover you're capable of that, how does it change your view of yourself? How does it change your view of your IBS or your pain or your fill in the blank? And it's, I'm pretty intellectually sophisticated and I can get bored pretty easily. And yet for the last 50 years, I don't think my fascination for hypnosis has diminished by even a milligram. It's still just, you could probably tell that I'm still passionate about it. I'm still totally into it. And how many times over the last half century, I have watched people right in front of my face doing things that while I'm watching it, I'm thinking to myself, no way, except there's a way.
Wow.
So it's held my interest all these years.
Just aware of the time, maybe we'll jump into some of the questions from the audience as well. And if we can't get to yours, I'm sorry, but we'll see what we can do. So the first one is just on the top. None of this is medical advice. This is just all information and general in nature. So, speak to an in-person practitioner or over telemedicine if you need any specific questions to yourself.
Yep.
So the first question is around complex trauma and how someone can self-heal themselves around that.
Well, complex trauma. Again, the label isn't what matters. It's the experience that matters. What defines the experience? Is it the intrusive visual memories, the flashbacks? Is it the quality of dissociation, of separating from your body in ways that make it harder to feel? Is it the hyper association to your body where you feel everything and it's amplified and dramatized? So the question is always, what is the experience of the person, and what are the kinds of experiences that we can suggest that will counter that will move the person in a different direction? So, what you're going to hear me say as a repetitive response to anybody who asks a similar question is, put the label aside and talk to me about what the actual experience is. Because what you're hearing from me as I talk about the merits of hypnosis is it's about changing experience. How can I absorb the person in a different quality of physical experience, a different quality of emotional experience, a different quality of thought processes or cognitions? And when you have a very clear target, this person is so bothered by let's say the flashbacks, the intrusive images. What might I suggest to this person that makes those images far less common, far less frequent, far less troublesome? And to experiment with different qualities of subjective experience. It can be superficial stuff that still works incredibly well. To tell the person to look at the memory through binoculars and now flip the binoculars around so that you're looking at the memory where it's so distant and so small that it's easy to dismiss it. Now, when you're sitting here consciously listening to that, you go, well, I don't think that would work. But to the person in hypnosis, that can be a life-changing experience. And that's the point, is hypnosis is so subjective. And you put suggestions out there, you put alternative perspectives out there, and you never know which one or which ones the person's going to latch on to. So the better that you understand how the person generates symptoms, how the person maintains symptoms, the more opportunities you have to interrupt those symptomatic sequences.
Thanks, Michael. Can you still hear me?
Yes.
Okay, my Zoom is frozen, but I'll keep talking.
Yeah, your image froze, but I hear you clearly.
Okay, I don't want to close the program because it might cancel the webinar, so we'll just keep it going.
Oh, I think I lost you now. Well, let's see is there a way for me to see questions? I'm going to the chat now, and I'm going to act as my own moderator for the next 7 minutes until Alex is able to get back on. There's Alex. Okay.
Sorry about that. I don't know.
That's okay. I was about to take over your job, but you're back, so go do it.
Can you still see the questions that were asked before in the question and answer box?
In the chat, yeah.
Yeah, there's like a separate question and answer. So the question that was there was asking, is hypnosis related to EMDR, so eye movement desensitization and processing?
It's an interesting question. Francine Shapiro, the originator of EMDR, was one of my friends and colleagues. And we have had the discussion many times. And Francine kind of went back and forth, times when she would say, I don't think hypnosis has anything to do with EMDR. And then we connect again 6 months later, a year later, and she'd say, I think there's a lot of hypnosis in EMDR. And then the next year she'd come back and say, well, I don't think there's any hypnosis in it. And then she'd come back. I mean, we went back and forth like this. And to me, it was really funny because all I can say is anytime you use any focusing strategy, you're making use of elements of hypnosis. Now, I make a distinction between formal hypnosis and informal hypnosis. Do you have to go through the ritual of hypnosis in order for it to be hypnosis? And this is one of the things that we've learned along the way. The answer is no. So to use EMDR in whichever format you use it is certainly going to involve focusing people. It's certainly going to involve some degree of dissociation. And I think that's a fundamental element of how EMDR works. But the more that you study hypnosis and understand the dynamics or the components of hypnosis, the more you will see them evident in just about every form of treatment. And in fact, the very last chapter of my hypnosis textbook, Trance Work, I make a point of doing that for readers. Here's the hypnosis in EMDR. Here's the hypnosis in mindfulness. Here's the hypnosis in CBT. Here's the hypnosis in guided imagery. And so there can be, every form of treatment that involves suggestion has hypnotic elements. Every form of treatment that involves focusing the person on new ideas and perspectives will have hypnotic elements to it that you might just not go through the formality of hypnosis. And you see this happen all the time. For those of you who are therapists, you get on a roll and you're saying things to your client that are, of course, brilliant and insightful. And then you look over at your client and your client's sitting there like, and you say to them, hey, are you paying attention? Well, what do you call that? I call that spontaneous hypnosis, the quality of absorption, focus that defines the experience. And so, yeah, if you're doing EMDR well, you're going to see that a lot.
Similar, just a question around neurofeedback. Is that also related to hypnosis?
Well, again, it's focusing and it's using a different source of feedback. And the fact that you can train brain waves is old news. We've known that for a very, very long time. The procedures have gotten more sophisticated as we've gone along. But the point is that you can use subjective experience to influence the brain, using the mind to influence the brain. And the quality of studies on that very issue has been really impressive in recent years.
There's a question around, is your training for therapists only or coaches and other non-professional, non-licensed individuals?
The course that I run is for healthcare professionals, people who have the academic background to be intervening in some serious problems. And I think that having that background is a foundation, and it's why I'm limited. We're doing practice sessions as people develop the skills. And if you don't have that quality of background and there you are working with other people, they discover very quickly, too often, that this just isn't hitting the mark. And it just really isn't fair to people to bring in people who just don't have that kind of clinical training, clinical background. So I'm pretty strict about that. I know that turns some people off and even offends some people, and I'm sorry for that. But this is like any serious clinical training. You have to really decide eligibility.
So there's a couple of questions around when people will see results with hypnosis and gut-directed hypnotherapy, specifically with IBS. So I'll take that one. What we've seen is in studies, in the study from Dr. Peters, who is the lead researcher behind Nerva, is most people won't see results, whatever you call them, within the first 3 to 4 weeks. Some people do in their first week from their first session. It really depends, but on average, it does take some time for people with IBS to see results, but it definitely differs based on the condition. So if you have other conditions, say with Dr. Gary Elkins and Evia, their study shows within the first week, people have a consistent improvement in their management of their symptoms, 10% on average every week. So it really does depend. Do you have anything to add there, Michael, or was that covering that?
Well, there are so many factors that determine therapeutic outcome. one of those factors is, of course, the therapy itself. Another factor is the way that it's delivered. Another factor is the person's level of responsiveness. Another factor is the quality of the person's expectations, whether they believe it's going to help or whether they don't. And when you look at all of the factors, and I just mentioned a very few, but there are so many factors that influence therapeutic outcome. But when people immerse themselves in the perspectives and experiences that are being offered to them, the possibility and the probability of getting good help relatively quickly increases dramatically. And so, for some things, it takes a little bit of time, a little bit of momentum. How many times do you need to hear something before you really get it? Some people, they'll get it right away, and other people, they listen to it 25 times and they're still not quite getting it. So, you learn something about yourself as well in terms of your learning style and the rate at which you learn and the quality of your learning. But obviously, I'm emphasizing the value of hypnosis as a vehicle for enhancing the learning process and enhancing the treatment process. And I think that's what I would really want to leave people with. There's really good reason, good science behind, good reason behind having people experience these sessions.
There's a couple of questions around the feeling of hypnosis and struggling to focus. So could you talk through, I don't know if I feel hypnotized, am I doing it right? And also, like, if I can't focus, am I doing it right?
Hypnosis is a very subjective experience. What does it feel like? Is it fundamentally different than other experiences? When people have the idea that somehow when you're in hypnosis, the lights are going to flash and the bands are going to stroll by, it's pretty unrealistic expectations. It's part of what makes hypnosis so unique is that it isn't unique. Paradoxically, that if you think about the times that you get caught up in something that you're doing, it can be something as simple as you're doing your email. You're sitting in front of the computer. Somebody you live with says, dinner, and in the back of your mind, you hear them say it, but you don't want to pull yourself away from what you're doing in order to respond to it. And then they say it a second time, and then they say it a third time, and then finally they walk into the room where you are and say, I'm calling you for dinner. And the reality is you've heard them all along. Now, what does that feel like? What does it feel like to be absorbed in doing email? Is it special? Is it different? And that's the thing about hypnosis is your attention is narrowed to some stimulus, but you're still aware of the peripherals. Even when someone's in deep hypnosis, they're having surgery with hypnosis as the only anesthetic. They're on the operating table. The surgeon makes the incision. I can ask the patient, how you doing? They'll say, fine. Comfortable? Yeah. Need anything? No. I'm talking to them while they're having surgery. Do they know where they are? Of course. Do they know what's going on? Yes. And they you don't just hypnotize somebody and wheel them into an operating room. They'll have learned to practice how to build it and maintain it. This person's got to be able to maintain that quality of focus throughout the surgery. And they've got to be able to maintain it in particular when they hear the surgeon say, oops, and still stay focused. So it doesn't feel like anything spectacularly different. The relaxation is nice, but the relaxation isn't even the defining characteristic. Can you do hypnosis without relaxation? Yes. Can you do hypnosis without dissociation? No. That quality of being able to take global experiences and break them into component parts, different elements. And so the second question was about when people have difficulty focusing, paying attention. That's who this is for, especially. How do you build an attention span? Now, you have to approach it differently if you're the practitioner, If you're dealing with somebody with ADD or ADHD or any of a number of conditions that have a negative impact on people's ability to focus, pain disrupts focus. High levels of anxiety disrupts focus. But the use of hypnosis to build an attention span before you ever attempt to use it therapeutically. So I may do a short hypnotic induction with someone, a short hypnotic process. I'll record it, give them the recording, have them practice with it, get used to the idea of focusing, and slowly build the ability to stay with it for longer and longer periods of time. Initially, they might only be able to stay with it for 5 minutes. A month later, they're able to stay with it for 25 minutes. The ability to build an attention span is a particularly valuable aspect of hypnosis, especially these days when all of the things that compete for our attention interfere with our ability to focus well. You know, every time your phone dings because somebody sent you a text, everybody stops what they're doing to read the text. You can't build an attention span that way. And so the use of hypnosis as a deliberate means of building an attention span happens to be one of the really beneficial uses of hypnosis.
On that note, I think we'll end the webinar. We've gone 5 minutes over. Thank you so much, Michael, for your discussion today. It was super interesting, and I hope for everybody they found it valuable as well.
My pleasure, Alex. Thank you. And continued success with Mindset.